Hey, everybody. Good morning, good evening, good afternoon. Welcome to Pep Talk, the podcast where we give you the truth, the whole truth, and nothing but the truth. So help us God. I'm super excited to be with you today. We normally take all these crazy, complex, interesting medical conversations, health conversations that are out there, help you understand them, give you some action steps that you can take to improve your life and the quality of your life of your loved ones. Today's a little different. Those of you that know me know my name is Dr. Eric Naputi. I'm your host of Pep Talk, and today we're going to talk about, 10 of the top lies that our healthcare system, our supposed healthcare system has told us, and I want you to understand that how the truth, it can set you free. And I want you to start understanding that life is all about the quality of the questions that you ask yourself and you ask other people. And so for many, many years, many decades, we were unable to ask questions about our health and how's that working out for us. I'll just tell you right now, it's not. If you look in the United States alone, look at the top leading causes of death in America. The number one leading cause of death in America is heart disease. Some 700,000 Americans die, 650 to 700,000 Americans die annually from heart disease. Number two is cancer. Some 500 to 550, maybe 600,000 people a year die annually just in America alone from cancer. The third and final leading cause of death, well, not final, but the third leading cause of death in America is iatrogenic death from our healthcare system, from properly prescribed drugs, from mismanaged care, from misdiagnoses, from people dying from surgeries and infections they've gotten. I mean, it's crazy. It's the third leading cause of death. And I got to tell you, over the past 50 years, we've been misled by our supposed healthcare system. And that system has prioritized profits over people. And I don't know about you, but I'm done with it. This system has propagated lies and has called people the worst names that you could be called for exposing those lies. This system has propagated and disguised science as facts, political science, if you will. And the trusted, resources have now all come to be part of the system that lied to us. A current study shows that you can make a study say whatever you want it to say if you funded that study. And we've trusted them to our determinant. We have now been in a system of chronic illness, obesity, mental health disorders, and chronic illness is at an all-time high. It's time to change. But in order to change the future, we have to recognize the problems in the past. And so let's talk about what I feel are some of the top 10 biggest lies that have been told to us by our healthcare system. Number one, the food pyramid. Hippocrates, the father of medicine, said, "Let thy food be thy medicine and thy medicine be thy food." And we now live in a world where our food is killing us. Where we 20 years ago didn't have to talk about organic food. We just talked about food. We didn't have to worry about high fructose corn syrup and PFAS chemicals and forever chemicals in our food and water supply. We didn't have these issues. It all started when the food pyramid got overtaken by government agencies and individuals who had their own pocketbooks in best interest as opposed to people in best interest. Let's talk about this. The food pyramid, here's the lie. The food pyramid recommends a diet high in grains, low in fat, and moderate in proteins. We were told we should consume 6 to 11 servings a day of grains to have a balanced nutritional diet. The truth is that the individuals who created the food pyramid, when the studies came out, their own scientists said, no, we should not have this food pyramid this way. We need way more protein. We need way more good fat. We need a lot less carbohydrates. They inverted the food pyramid, and that led us to where we are to this day. The food pyramid was created to serve the interest of the agricultural industry, not your health. Grains, especially refined and processed grains, are the major contributor to insulin resistance that leads to obesity, chronic inflammation, and all the comorbidities that go with that. Meanwhile, healthy fats and proteins, which are essential for optimal health, were minimized or ignored by the food pyramid. We have a massive protein deficiency in this world today. We have been lied to and told that red meat is going to cause colon cancer. That's a lie. They're telling you that if you minimize your meat intake, you're going to optimize your life. Well, guess what? The proof is in the pudding. That's a lie. And we don't need to do anything other than look around at our friends and family and loved ones. Look at a picture of people on the beach in the 1970s compared to people on a beach in 2024. I mean, come on, it's preposterous what's happened. Here's an example. Here's an example of the propaganda. Agricultural lobbyists, the USDA, which designed the food pyramid, is closely tied to the grain industry. Their recommendations ensured that high demands for their crops like wheat and corn, boosting profits while disregarding the metabolic damage caused by a high carbohydrate diet. They demonized fats. Particularly saturated fats were labeled as dangerous, despite clear evidence to the contrary. The resulted in the low-fat craze, the low-fat, no-fat craze. The I can't believe it's not butter led to more heart disease than you can even believe. This led to an explosion in processed, sugar-laden food marketed as healthy. I can't believe it's not butter because it's not butter. It's called heart disease. Cholesterol has gone up immensely ever since we've done these things, and it's just disgusting. And they suppress the research. Listen to studies from the 1960s that implicated sugar, not fat, as the primary driver of heart disease were buried by the sugar industry, shifting blame to the fat industry instead. By the way, real-world implications of this, I can't tell you how many patients that I've had that have been told, I have to eat a high-grain, dense diet. I can't have fat. I can't eat protein. Within about 45 to 60 days of shifting someone from a food pyramid diet, the standard American diet, to a high carnivore, keto-type diet can reverse almost every type of type 2 diabetes. Almost. Okay, that's under my direct supervision as a physician. We've seen that. By the way, the second lie, fat is bad. They told us that saturated fat clogs our arteries and causes heart disease, so they must be avoided at all costs. No, it's the sugar. The sugar molecules are like little pieces of glass, and when that glass goes down the lining of our arteries and our veins, that scratches holes in it. And what happens then? Now cholesterol and plaque fills those back in. That's what hardens our arteries and clogs our arteries. The truth is that healthy fats are essential for brain function, for hormone production, and for cellular and neurological repair. When we don't have this leads to neuropathy, neurological degenerative changes like Alzheimer's, Parkinson's, dementia, depression, anxiety. It leads to a whole slew of chronic inflammation because we've been lied to. You want to hear some propaganda? Low-fat food boom. In the 1980s and 1990s, food manufacturers stripped fat from production and replaced it with sugar and artificial additives. Companies like Nestle and Kraft profited immensely while rates of obesity and diabetes skyrocketed. They cherry-picked the data, by the way. Ansel Keys, have you heard of that name, Ansel Keys? Look it up, A-N-C-E-L Keys. This guy was a massive propagandist, okay? There were 7 country studies that falsely linked fat consumption to heart disease by excluding countries where high-fat foods correlated with low heart disease. They literally cherry-picked the studies. And then the statin industry profited on a level that most people can't understand. The demonization of fat paved the way for cholesterol-lowering drugs, creating a multi-billion-dollar industry. Again, I could give you story after story after patients that have had, we put on a high keto, high fat diet, good fat, not vegetable oil fats, real fats, not seed oil fats, real fats, animal fats, omega-3 fish oil fats, getting them on coconut oil, MCT oil, real good tallow, healthy, good fats. Like it can reverse blood sugar issues. It can reverse high blood pressure. It can reverse brain dysfunctions. I mean, and getting people on a high protein diet can help them get rid of chronic pain, chronic inflammation, and help them with their hormones. Here's another lie. Cholesterol causes heart disease. They told us that cholesterol is the primary cause of heart disease, and lowering it is the key to stopping heart disease. That's not over the years, we've seen an increase in cholesterol medication. We've seen a lowering of the normal cholesterol number. It used to be 300 was your total cholesterol normal in the 80s, and now they want it to be below 200, and yet we see more deaths. It's just absolutely ridiculous. Anybody would believe anything that these jokers tell you. And the truth is that cholesterol is essential for hormone production, brain health, cellular repair. And elevated cholesterol often reflects underlying inflammation or imbalances in nutritional toxicities, deficiencies, and elevated sugar in the diet. You want to know some propaganda on this? Statins for all, that's what they said. Pharmaceutical companies push the narrative that everybody with high cholesterol needs statin drugs, creating a $30 billion a year industry. By the way, 9 out of the 11 people on the board that determine the cholesterol numbers that are healthy numbers, 9 of them had conflicts of interest with statin manufacturing companies. They fear-based marketed. They told patients, they were told that they would die of heart attack without lowering their cholesterol. Still to this day, I hear people who are lied to by their doctors. Doctors should go to jail for that, or at least lose their license if they tell somebody, you're going to have a heart attack because your cholesterol is too high. Simply wrong. And ignoring the metrics, man. Look at this. Like more critical markers like triglycerides to HDL levels or the C-reactive protein levels, those are more favored of telling the risk for heart attacks and heart disease, not cholesterol. It's just sad. Here's another one. This is going to ruffle some feathers. Vaccines have zero risk. That's a lie. They told us that vaccines are completely safe and adverse effects are rare, if non-existent. Well, then why in the 1980s, and I think it was 1986, it was, Congress was having hearings on this, and legislation was passed in 1986, making the insurance companies for vaccine manufacturers the federal government because they could not get third-party insurance companies to insure their product. They couldn't get product liability because, and I quote, the vaccines are innately dangerous by nature. That was what was said in the hearings. The truth is, while vaccines have reduced certain diseases, denying their risk and ignoring individual variabilities and immune responses is an informed consent is horrible. That's the truth that we should have. Here's some propaganda. This one-size-fits-all messaging. Look, the healthcare system promotes universal vaccines recommendations without genetic, environmental, or health differences among individuals. Like, that's crazy. The latest research that now the American Medical Association presents on says that, you know what? That kids between the age of 6 and 11 that got COVID shots fared the worst out of any group that was out there. This is just the facts, you guys. It's not a religious feeling. Like, this is a fact. And the polio vaccine caused polio in people, and MMR shots caused measles outbreaks. And I mean, there's good, bad, and ugly with everything. So, and then the censorship, anybody that questions vaccines, like Bobby Kennedy Jr. to this day, who is not anti-vaccine, is mislabeled by propaganda that's trying to push a narrative to push profit, saying he's fully vaccinated. So are his children. The only shot that he didn't get was the COVID shot. And I'm not trying to make this political. I'm just telling you the truth. Vaccine manufacturers are shielded from lawsuits. Like, I can't even give you my vitamins or my advice without having malpractice coverage, but the vaccine manufacturers are shielded from liability, reducing the incentives to improve safety. Like, that's a problem. Anybody that doesn't think it is, you're probably a problem. Number 5, pharmaceuticals are the only solution. How did we live the last several thousand years without pharmaceuticals? How did we live to get to the 2000s, the 2024, 2025 without medications prior to that? They lied to us and said health problems should be treated with pharmaceuticals, and lifestyle changes, diet, and holistic medicine are ineffective. That's the biggest damn lie you could possibly get to. That was intentionally done from the beginning. When Rockefeller and Carnegie took over the healthcare industry, they propagandized it. And the truth is that most health issues stem from root causes: poor diet, stress, environmental toxins, and addressing these factors eliminates the need for medications. But there's lots of propaganda. I mean, symptom management. Look, the system prioritizes treating symptoms with pills over addressing the root cause. And then marketing over science. It's political science over science that's really, truly done this. Drug companies spend billions of dollars marketing and lobbying legislators to allow them to push their drugs. We need to get rid of pharmaceutical advertisements on television. We're the only country left that does this. Up until a few years ago, it was us in New Zealand, and New Zealand got rid of it. So the U.S. is the only country that allows direct-to-consumer marketing for their drugs. And by the way, every single drug has a side effect. If you look at the last 30 seconds of every drug commercial on television, it's the bad stuff that happens with the drugs. Why don't we focus on root cause lifestyle change and alternative therapies? Oh, I know, because it doesn't make the pharmaceutical company billions and trillions of dollars. Anybody that thinks different than that, you're just wrong. You're just naive. Like, I used to be blissfully ignorant, but man, it's just not a place to be. Here's another one. Another big lie. Let me pull this one up. I already did the pharmaceutical one. Here's another big one. And this one, a lot of folks will go, yeah, I've heard that before. Is health insurance is the key to keeping you healthy. Well, folks, if health insurance was the key to keeping you healthy, then why is it that 50% of all people who file bankruptcy in this country have health insurance? And why is it that Medicare guideline, let me read something to you. I'm going to pull this up. Medicare guideline. Medicare is the guideline where all insurance is based off of, okay? Let me pull this up. Medicare is the gold standard. In the U.S., it's our government-backed insurance. And all the other insurance companies have to dictate the level of coverage they have based off of Medicare. This is right out of Medicare's guideline. Look this up. This is Medicare Guideline Section 2251-3. 2251-3. Medicare Guideline says a treatment plan that seeks to prevent disease, promote health, prolong and enhance the quality of life, or a therapy that is there to maintain or restore or restoration of chronic condition is not medically necessary, and it's deemed not covered by your insurance. Folks, the system is rigged against you. You need to understand that it's your responsibility to understand how to take care of yourself. And self-care is the real healthcare. Understanding how to take care of your microbiome, understanding how to take care of your cells, understanding how to take care of your autonomic nervous system, your central nervous system, and your genetic expression. Those are the keys. Those are the 5 factors of health. Understanding that health is a balance of physical, chemical, and neuroemotional well-being. You've got to get educated on this, because if you don't get educated on the root cause of your problems, you're never going to fix your problems. And that's why we have so many people that are fat, sick, and nearly dead to this day. People don't know where to turn, and they just get scared to death because the system, well, it's lied to us. Now, I could keep going on and on and on and on, and you guys go to our website. We'll have more data on this, but I want you to tell me, let me know what you think. Go to our website. Go to peptalk.world. That's peptalk.world. Like, subscribe, and share. Go to all of our social media platforms. And I want to hear from you. I want to know what you think. What are other lies that we've been told from our healthcare system? And I want to know, like, are you like me? Are you sick and tired of this crap? Are you tired? Like, I'm a physician. All I want to do is help people. But there are certain words that I can't say. I can't say that certain supplements prevent, treat, cure, or mitigate problems, because the pharmaceutical industry lobbied for them to be able to use those words and not us. I could get sued, deplatformed. They already sued me for $500 billion for helping people during COVID. Literally ridiculous where we're at. So go back, rewatch this, reread this, share it with your friends and family. Go to our website, peptalk.world. Like, subscribe, and share. Make sure that you're going back and reading these and sharing these with folks, because knowledge is power, and that's what they don't want you to have. They don't want you to be knowledgeable, because knowledge is deadly. It's scary to them, because the more knowledge you have, the more responsibility you can take for yourself. And you got to understand that knowledge is power, but wisdom is taking that knowledge and applying it to your life. So folks, until we meet again, I'm Dr. Eric Naputi. God bless you, God bless America, and God bless the world. Stay smart out there, and I'll see you soon. Be well.